Hello guys, I decided to do my internet assignment project on WebMD just because I feel like it's a very controversial website for its credibility and actual usage. So I thought it'd be interesting to look at the resource and what its real purpose is. So when you click on WebMD, you can see up here, it's not fully showing, but it's Better Information, Better Health. So they are full of sources and tools to help those that are looking on their website. I'm going to go ahead and show the About page really quick. It says that it is a valuable health information tool, tools for managing your health and support that they're seeking from. This can be used for more of a support center because it includes podcasts, messaging boards, question answers, expertise, blogs, links to doctors, drugs, comparing, and it's a lot of information and you getting to know what's going on with you so that the user has more power to choose for themselves. Okay, so I really do think that they try to stay accurate and up to date with their information. I'm going to go ahead and show the doctors. They have 4 main doctors that work on this page, but they team up with over 800 nationwide doctors, which that supplies it with accurate, current, relevant information, and it has a wide range of expertise. So people can see the relevance for them in their own life, and it allows for more specialty information. So I really do think that this addresses the validity of this website. Although sometimes it is thought of as not credible, I do really think it has the backbone and authority to be a credible website. Okay, so I'm just going to show you how someone would basically use this website. So let me Google my symptoms. So let's say I have stomach pain on my left side and nausea. Okay, let's look that up. So when I look that up, diverticulitis is a disease that has these symptoms, and you can notice it's WebMD showing this. Now I would address that this is probably the bad part of WebMD. Somebody would Google their symptoms and immediately think that they have a serious disease or serious disorder, and it's scary and they think they're going to die. So I really do think it's up to the user's choice for them to stop looking into it, but this really scares off users. So if you click on this, you can go to the different types of symptoms. These symptoms are extra linked, so you can kind of make sure that you're experiencing that actual symptom. They have different other suggested links for you, like slideshows about the disease. They tell you to call your doctor, because I do note that this isn't in substitution of a doctor, but as an addition with, to really understand what's going on for yourself. And you can come to your doctor with questions. They do link treatment and just other sponsored ads, other articles at the bottom which are pertaining to what you are looking up on their website. On the side, since this is a digestive disorder, they do link other digestive disorders, which I find really important because say I have 2 of these, but I don't have the rest. I want to look at other diseases to make sure that maybe I don't have one of those or I do have this. It's really good to make sure that you're not immediately thinking you have one thing when you may have another. They do have slideshows, quizzes, videos, question and answers, message boards, and a link to extra doctors about this specific disease. They have more information. Yeah, so that's pretty much how somebody would basically use this website. But I just want to give a quick layout rundown. When you click on WebMD, you have the basic trending topics and articles for you to click on. They have the videos. This is for somebody, say, if you look up here, they can subscribe to this website. So somebody would click on here and kind of get up to date on some health issues and current events, up to date information, just about the health area in general. Okay, let's go to their top link. So they have health disorders and conditions and diseases listed alphabetically. They have their resources right here, which are a symptom checker. They have blogs, podcasts, message boards, question and answers, insurance guides, and finding a doctor, like I said. We have drugs and supplements, which they give the basic information about drugs and supplements. Then they have their tools, which is manage your medication, pill identifier, and check your interactions. I think this is an extremely helpful tool for those trying to understand their disease and manage it in a way that they have power. They're not just told what they have to take and they can understand it better. And then they have the drug basic safety. They have a living healthy section. So this, like I said, would be somebody that subscribes to this website and say they really like to learn about healthy beauty. They could click on here, and there's a numerous amounts of articles, discussions, question and answers, and like kind of like a discussion area for what you're interested in. They have a family planning link, which has stuff all about pregnancies, parenting, and pets. They have the news and experts. So all like the topic, all the big current events in the health world, message boards, expert blogs, news center. Up here they have the basic check your symptoms tool, which I showed you guys earlier. Finding a doctor, so say I'm looking for a specialist, I could look that up right here. And comparing drug prices, which I think is another extremely helpful tool about this website. Another list of helpful tools that they have a BMI calculator, like I said, the drug comparing tool, the ovulation calculator, fitness calorie counter, food calorie counter, and due date calculator. So I really do think that WebMD aims to supply everybody with stuff that's relevant for them. Say you're not on this website because you're suffering from Crohn's disease or diverticulitis, but you just want to learn how to count your calories and what's proper nutrition, or proper eating of carbs, and kind of just learn different discussions that are going on so you can choose what's best for you. I think they do their best to supply everyone with a wide range of information on just one topic. And I really do think it can be used for a health educator, not just patients. So a health educator can refer their patient to this website or go on this website themselves and see what's going on right now. What is going on? So say there's a debate about the diets for someone with diverticulitis. Someone can really come on here and learn what's going on, tell that to their patient, and refer their patient to this website to say, learn more, choose for yourself, have power in what you're doing. So I really do think that this website is valid, and I really do think they work to promote healthy living, as they have the Living Healthy area, but also when you aren't healthy, and they're going to supply you with that information. So thank you so much. I hope you guys enjoyed this, learning more about WebMD, and can now use it as a better tool.